All right, we're here live from the Healthcare Interactive Conference, HCIC, here in Las Vegas, Nevada. And I'm sitting down with my good friend, I like to think of you as a colleague as well, Pam Landis. Welcome.
Thank you for having me, Chris. It's been a great show.
It's been fun. And
Yeah.
you've been involved in a number of sessions
Right.
Today. But before we jump into what we're going to talk about, I'd love for you to share a little bit about yourself and your background and where you are today.
Thanks. So for folks, I'm Pam Landis. I'm the Senior Vice President of Digital Engagement at Hackensack Meridian Health. And so my team works really on the 4 domains of digital at HMH. The first one is, how do we acquire patients? Digital acquisition, SEO, SEM, digital buying, research, analytics. How do we acquire that patient? The second A is, how do we activate them? Do we send them to the websites, MyChart, texting platforms? So how do we get, after we acquire them, activate them, then we send them to Access. And that's really our Access Center, multi-channel Access Center.
Yeah.
And finally, we want them to adopt us. We make it so easy for them to stay with us through the use of virtual technologies that they won't leave. So that's what my team works on. I've been in healthcare since 1995.
Wow.
I was working in clinical PR for a great academic medical center, and my boss leaned out of his office and said, we really need to figure out this World Wide Web. That was 1995, and I volunteered. I said, well, I could do it because the server for the department lived in my cubicle.
Oh my goodness, really?
And I volunteered for it, and I bought a book, HTML for Dummies, and that started the journey in 1995.
Really?
Mm-hmm.
So 1995 technology, very nascent.
Very nascent.
Right?
Right. Even the hospitals and health systems did not even have centralized IT departments. There was no concept of a CIO then.
Yeah. So, and here you are now, what, so many years later?
30 years.
30 years? Wow. You have seen so many changes
I have.
To the space.
Uh-huh.
We're now fully blown digital departments like the one you run in Hackensack Medical. But what strikes me and as how I'm going to write it back to what you were on this panel about women in technology.
Women in tech.
Look how proud you are, which you should be. I could imagine that it was very, very difficult for you at the early onset, technology stuff aside, but just by the mere fact of your gender.
Yeah, so you would go into the, I remember going to the data center and sitting next to a guy talking to me about the Unix box that he was incredibly proud of. And that was where our website was going to be. And I was like, well, can I see it? And he was like, you want to see it? And I said, show me what you do. Show me how you bring this to life. And I think that was the first time somebody had said, I'm really curious about your work. And they just didn't, hear you're the cog in the wheel. I was like, no, show me what you're doing. This is interesting.
Yeah.
And I used to be a reporter, and I took that approach that I just wanted to ask a lot of questions of all those people in tech, and I learned from them.
Oh, wow. That's great. But did you, so in your panel today with women in tech, some of the things you talked about were, some of the lessons you've learned. So can you share a little bit some of the...
I think that some of the lessons I've learned was to be curious, to be respectful, but also to be assertive and to know, don't let yourself get gaslit into settling for less. Don't let them say to you, oh, I can't do that, but I guess I could do this. When you know that they could do what needs to be done, stay true to the project and to the program and to what you're trying to achieve. No, you don't have to be unreasonable and say, okay, maybe we phase it out. But I would say that don't lose sight of the business requirements that you are there to see fulfilled. And make sure that those get fulfilled.
And those are really good lessons to learn, but I want to get back to the being assertive, because the Pam Landis I know, you're very assertive.
I am.
Was that a learned behavior?
Yeah, my brothers would say yes. I've been always like that. Yeah.
You were raised with brothers.
I'm the oldest, and I'm the only girl, so all those memes about, only girl, oldest child, daughter, being the bossy, yeah, that's me.
I've been in healthcare for 15, 18 years. And maybe it's not kosher to say on microphone and camera, but there is some inequalities, let's just say, that occur. I've seen that play out often.
Yeah. Yes, that is true. And so the challenges for women in my position is, so that's why I'm so passionate about women in tech. My job, as part of my work, I really think it's important to lift women up in this work.
Yeah.
And to identify other women who can do this work and mentor them and bring them along. And as assertive as I am in the work, it's about the work, I still want people to feel that they're valued and supported and respected in the work that they're doing. But I will push them as hard as I push myself. But I really do feel an obligation to find those diamonds in the rough, those women at other departments. Like, you could work in tech. We could learn from you. Your experience in operations, come on over, teach us.
Right. What are the characteristics that you look for? I mean, obviously assertiveness, but...
Yeah.
But
I actually want somebody who's intensely curious and relentlessly competent.
Right.
And I told the story in the panel earlier. I knew a mom from my son's school. She was president of the PTA, and I kind of was dreading going to these PTA meetings. And I went. It was the most efficient PTA. It was the most efficient meeting I'd ever been to. And I'm like, who is this woman? She'd been out of the paid workforce for 19 years, raising her boys. And I met her, and I gave her this small freelance project that I thought would take 6 months. She was a mom of 3 boys. She got it done in 6 weeks. And I said, oh, how did you do it? And she told me the steps, and I'm like, you are a thoughtful, well-organized person who understands how to get things done. You're hired.
Right. That ability to multitask, that ability to...
I could teach the technology. Yeah, we could teach that.
Yeah.
What I can't teach is how you figured out how to solve the problems.
Right. And that's the hard part, right? Is to find people that have that innate curiosity and that ability to manage that, and particularly in this kind of rapidly changing space of healthcare technology.
Yeah.
Healthcare technology and technology in general is sometimes pervasive with tech bros.
Right. It is. Well, yeah, sometimes you go to the conference and everybody's got the same Allbirds shoes and Patagonia vest. I know, I looked at it and I'm like, and they want a chest bump, and I'm like, I don't know. But it's okay.
Yeah.
It's okay, because as long as they're committed to the work, you got to welcome it all. But be open to the diversity of ideas and thinking and approaches. And I think that helps.
I think that is the undercurrent here, right? It's like, this is what really we're talking about. We're not talking about like blindsiding to one half of...
No, not at all.
We're talking about being having the curiosity, being open to new ideas and new diverse perspectives.
Right.
And I think that's the thing that I see with great people that are very successful in technology is they don't get siloed into a one way of thinking.
Right.
They are very open to that. And I think from my perspective, and this pivots to the other conversation today, I see that happening. AI as a technology is one that's becoming more nimble and more adept to seeing different diverse ways of doing things. Would you agree with that?
Yeah, and I went to some of the sessions the last 2 days around AI, and they were very thoughtful and really good. And one of them was when the woman said, it was Mona Bassett from Intermountain Health, and she said, AI is an enabler, it's not a strategy.
Right.
And I'm like, good on her, but it puts it into the perspective. Don't chase that as a strategy. Chase that as a way, how does it help me do the work better, more efficiently, and make it better for patients? And I thought that was the right approach.
We've heard a lot about like AI as a co-pilot. I recently heard a term, they call it cobots.
Oh, right. And I heard another one today where he called it digital employees, the digital assistant employee, and that you would be managing your digital assistants like you're managing your regular team.
Yeah.
And you were going to start evaluating whether they were performing their tasks up to the standards that you had set for that bot. And I was like, what a fascinating. So now, do I have to build a capability and a skill set to manage digital bots?
Right, exactly. They're new. That's an interesting.
I was like blown away.
But when you described it, it makes a lot of sense,
Exactly.
right?
Mhm.
Because that's how you want to use the tools.
Right.
That's how you want to. That's the promise of what technology can
It is.
provide us,
Mhm.
and particularly when we're facing all the challenges that we face, right? In your organization, very complex. It's complex everywhere.
Right.
Healthcare is complex.
Right.
We need more tools and technologies that we can utilize to help
Yeah.
support this. And I like that they're kind of assisted
Yeah.
next to you. But we're not talking about losing jobs.
No, not at all.
We're
No.
talking about just augmenting what
Absolutely.
you're currently doing. Right?
Yeah. I don't want, we've got people that need to get appointments, and I want our phone agents and our contact center agents to spend time on they're going to become not just schedulers, they're going to become care navigators. And that the interactive voice agents are going to take care of all the routine stuff.
Right.
So that those agents can really take the time to embed themselves in the patient's navigation journey.
Yeah, absolutely.
That's what we want.
Yeah, that's absolutely true. So what I love about you is you have 30 years of experience. You're a leader in this role, and you're a leader in our industry, quite frankly.
Thank you.
And you also, you have a good sense and an open mind still to this day of how things are changing.
Yeah.
So keeping that in mind,
Okay.
if someone new was coming into the industry, what advice would you impart upon them?
I would tell them here's one thing. Be respectful of the work that has come before you. And that know that you stand on the shoulders of people who have done a lot of really great work. So sometimes you see people come in and like, oh, I'm gonna change the world and we're gonna blow this up and no. The organizations we work for have been serving patients for decades, and some of it for a century. Be respectful of that.
Yeah.
And that they have built a fine healthcare organization that's taking care of people all day, every day. So I would say be respectful of that, but also be open to engaging them with the what's next. Be that ambassador to say, let's get ready for this.
Right. Be adaptable.
Exactly.
Being able to be have open to new ideas.
Yeah.
And multitasking.
Exactly.
It all circles back together, Pam.
Exactly.
Pam, thank you so much
Thank
for this
you.
conversation. It was a really great one.
All right,
Appreciate
thanks.
it.
All right, thanks.